It is 7:40 on this Tuesday, January 2nd. Good morning. I'm Tori. And good morning and Happy New Year, Dr. Jaimie Ronchetto from Cinema Vet.
Happy New Year.
Happy New Year to you, too. Were the holidays good to you?
They were.
I know. But it went by real fast, didn't it?
It always seems to.
And I know. We got to work on that somehow. And here we are, January. So much I want to talk to you about. First of all, as humans, we make New Year's resolutions. Mm-hmm. How can we make a New Year's resolution for our pets? Is there anything we can resolve to do for a healthier pet, a happier pet? Is there anything that maybe we're not doing? Because I think as people, and it's human, we're human. So we sometimes get a little bit lazy.
Sure.
Is there anything we can resolve to do to make 2018 fantastic for us and our pets?
Yeah, I think that's a really good point. I know a lot of people tell me a lot of times, well, they've just been putting off coming in to the vet just because, like you said, life gets in the way, you get busy, especially with the holidays, you're doing other things. So I think for January, it would be a good time to start off on the right foot and make that appointment, get in to see your vet, take all of your critters in. So, even the indoor-only kitties definitely still need to be seen. Your young or older pets, certainly get that physical exam done. Talk to your vet about any issues that you were concerned about, anything that may come up on the physical exam, so that then you have a game plan as to best treat your pet.
Those doggies, it's been the holiday. They might have gotten extra treats. They might have to have that resolution of dropping a couple of pounds,
Probably.
Right? I think I remember the vet telling me at one point somewhere along the line that 1 pound on a dog is about 10 pounds for us. Is that kind of equivalent?
I think it's a good guideline. Certainly it depends on the pet. So smaller dogs, obviously a pound is going to do a lot more than a really large dog. So it can make a big difference for sure.
It can. Next month, big month. It is National Dental Health.
It is February.
For pets.
Yes.
We should be going regularly as humans every 6 months, but for pets. Now, what do you suggest? So there's going to be, are you going to have something special at Cinema Vet? Do you have specials, or do you do advertising? Make sure those, the pet owners come in and get those teeth cleaned, or?
Yeah, we usually do advertising. We usually run some sort of special during the month of February. Sometimes we extend it into March. So again, it's January would be a good time to come in, get the exam done, get an estimate for the dental. There's different grades of dental disease. So it could be as early as a grade 1, or it can be as terrible as a grade 4, just sort of depending on what's going on. So that's a good first step, is come in, get your exam, have a full dental exam done so you can get that estimate and know what needs to happen.
What's the difference between a 1? I know in humans what's the difference between a 1 and a 4.
Right.
But what about, you bring in your little doggy, and what's a 1 and what's a 4?
Yeah. So a 1 would be if you see basically normal enamel, nice white teeth, but maybe just a little bit of tartar, so you see a little bit of yellow or brown along the gum line. Mm-hmm. That's basically a grade 1. Mm-hmm. All the way to a 4 would be very bad gingivitis, so really red inflamed gums, maybe some gum recession, so you're seeing some roots of the teeth, very, very heavy calculus, so lots of brown on the teeth, not a lot of normal white enamel.
Can that be if it gets to a 4, mm-hmm. Can it be fixed?
It can be fixed. A lot of it is management, so definitely important to come and get that cleaning done, so we actually clean the teeth, get underneath the gum line, take dental x-rays, see what the roots look like.
Okay, wait a minute. Now, how do you get, because I know how we do, we lay down in a chair in the dental office and they lay the thing over us before we get, how on earth do you get the pet to remain still enough? Because you have to remain still to get the x-rays. Right. How do you do that?
Well, that's why they're sedated. So we do use anesthesia. So they're fully anesthetized, and that's how how we can get that full cleaning done, because a lot of times their mouths hurt at that point. So, it's less stress to them. It's safer for everybody involved. And then we can get the dental x-rays done. So our probe is safe. It's not going to get bit, and then certainly if there's any extractions that need to happen, we can just do everything at the same time.
So even if you've, because I know we always say, oh, my dog has doggy breath. There's a normal doggy breath, and then there's a not so normal doggy breath.
Right.
And,
honestly, typically most of the quote unquote doggy breath that I come into contact with, when people are actually coming to me complaining about it, there's dental disease of some sort going on. So the bacteria in the mouth, cause the halitosis. So in getting the teeth cleaned, getting all of that out of there really helps to prevent that from continuing. But then it's also home care too. So we always recommend some sort of home dental care, whether that be toothbrushing, which is certainly best if your pet will allow that, or, dental chews, water additives. There's lots of different things that we can do.
Excellent. So that's next month. We'll be talking about that again in a couple of weeks when you come back and visit. But in the meantime, make a resolution. What do you think would be probably a good resolution for us as pet owners for the pet? What do you think? Maybe walking the dog more, playing with the dog more. What do you think would be the best thing we could put at the top of our list for a New Year's resolution?
That's a really good question. I mean, I think along with just getting in the door to be seen, so you can start the year off right and know it needs to happen. Certainly just interacting with them more in positive ways. So like you said, walking, playing with them, those are all good positive rewards for them that don't have anything to do with food. So that's the major challenge, is just finding other ways to show them your love without treats involved all the time.
I love it. I love it. Dr. J, because I love treats. So you gave me some ideas personally. Dr. Jaimie Ronchetto from Cinema Vet. If we want to make that appointment, which is very much recommended, start January off right with your pet. Call Dr. Jaimie at what phone number?
661-253-9300.
And make an appointment. And also, you're located on Cinema Drive.
Yes.
Between where and where? What's the best landmark?
It's pretty much right across the street from that big church. We're kind of near the end where, closer to the Valencia Boulevard end of Cinema Drive.
Excellent. I know exactly where that is. Who doesn't? We're down there all the time. I go to Stonefire, everything.
Oh,
okay.
Yeah.
Dr. Jaimie, always a pleasure. Thank you very much for the New Year's resolutions for our pets, and gave me a couple of personal ones. We'll see you in a couple of weeks. You have a great week, okay?
Thank you. You too.